Hello everyone. Today I'm excited to welcome you all to another episode of Let's Talk Health, our informative and engaging Facebook Live session. Today we have the privilege of hosting Dr. Kailash Mirchi, an eminent neurologist, who will be shedding light on a topic that is common and affects a lot of us. Any guesses? Well, it is headache. Let's explore the intricacies of this common yet often misunderstood condition and gain some valuable insights from Dr. Kailash's extensive expertise. Welcome to the session, Dr. Kailash. Thank you so much for joining us today to discuss on this very important topic, headaches and migraines. Before we start the session, I would I would request you to help our viewers understand a bit about yourself, your experience and expertise.
Okay. Hi, I am Dr. Kailash Mirchi. I am a consultant neurologist working at Citizens Hospital. So I have 7 years of experience now as a neurologist. I did my MBBS MD from Rajiv Gandhi University, Karnataka, and did DM neurology from Gujarat, Ahmedabad. So after that, I was working in corporate setup since past 7 years. So I have expertise in headache, stroke, and epilepsy. I'm more interested in autoimmune disorders as well.
Thank you so much for sharing. So my first question is, what is headache? Like often we get headaches with very simple reasons like lack of sleep or late eating or stress, sun exposure, etc. So help us understand about.
See, headache is one of the commonest symptoms, you can call it, which brings the patients to the neurologist. So, and WHO has declared headache as one of the commonest symptoms which patients will lose their duties. So, everybody will get headache one or the other day in their lifetime. So, there is nobody left from this symptom. So, it's the commonest disorder. And the thing is, if you are getting frequent headaches, then it becomes more bothersome. And we have to diagnose. There are different types of headache, like tension type headache, migraine, vascular headache, secondary headache, primary headaches. So depending on that, we usually treat those patients.
And what are the causes?
See, basically we divide headache into two main categories. One is called as primary headache and the other one is called as secondary headaches. In primary headaches, we have something called as tension type headache and migraine and trigeminal autonomic cephalgias. These are all the rare forms of headache, and we don't have any cause for that. But that is the reason we call them as primary headaches. And secondary headaches are those headaches in which we have a secondary cause. Like some patients will have brain infection, and those patients will get headache. Some patients will have brain tumor. Those patients also will come with headache. And some patients will have some blood vessel abnormalities, we call it as arteriovenous malformations. Those patients also will have headaches. Some patients, they come with severe headache, they have bleeding inside the brain. So these are all the causes which can cause the patients to have very severe sudden onset of headache. So these all are called as secondary headaches because there is some reason for the headache. So these are all called as secondary headaches. Usually the commonest causes are primary headache. Among the primary headaches, tension type headache constitutes almost 70 to 75% of total headaches, and migraine constitutes 20 to 22% of the headaches. Hardly 3 to 5% of the headaches are because of secondary headaches.
We would also like to understand how long a headache can last and when we should consider it as a serious.
So see, I'll just give you briefly something about vascular headache, also called as tension type headache. Usually it does not have a pattern. If you have a lot of stress, work-related stress, if you are not sleeping well at night, usually these headaches you get. And usually they will not last for more than 30 minutes or 1 hour. So this is called as tension type headache. It will not have any particular features of its own. When you take migraine, so lot of patients will have migraine. Usually there are some triggers which induce headache in migraine patients. Like if you are not taking food on time, if you are not sleeping well, if you are going to sunlight, direct sunlight will trigger sometimes headache. excessive sounds will trigger. Some of the patients, some food habits will trigger the headaches, like if they eat cheese too much, if they eat sugars too much, if they are taking too frequently tea, coffee, chocolates, cheese, Chinese foods. Basically, they call it as my mayonnaise sauce, mayonnaise that contains MSG, monosodium glutamate. These are all the triggers for migraine headaches. So, when to consult a neurophysician is a good question, because there are so many simple headaches. Like everybody routinely they get headaches. For those things, if you do some pranayama, yoga, some surya namaskaram, if you hydrate yourself well, those headaches will go away. But there are some red flag signs. We call it as red flags. In those patients, you should consult a neurophysician. What are those conditions are? When you are getting severe occipital headache, what this is called as occiput. So when you are getting severe headache in the back of the head, usually it is because of hypertension. When you have very high blood pressure, you will not have any other symptoms other than headache. So those patients should consult a doctor as early as possible. And if the duration of starting headache and the peak headache is less than 1 minute, then those patients should also consult a neurophysician, because these patients usually have something called a subarachnoid hemorrhage, a bleeding inside the brain. And any headache associated with fever, you should consult a neurophysician. Any headache associated with fits or epilepsy, we call it as seizures, those patients needs to consult to a doctor. Any patient headache with blurred vision, visual blurring, those patients should consult a doctor. Any patient, so some of the patient with stroke will have weakness in one side of the hand and leg, they will have developed weakness and headache. Those patients should rush to the hospital as early as possible. So these are all the red flag signs. In those patients, you have to consult on emergency basis.
Migraine headache, and what are the causes?
See, migraine headache is the second commonest type of headache. What are the features? Are usually they have unilateral headache, like only one-sided headache they usually get. And each episode of headache will last for more than 4 hours. So it can last up to 48 hours. Sometimes it can run until 72 hours. Up to 3 days, these patients will have headache. And associated with nausea and vomiting, these patients usually they feel like nauseous, puking out. And once they vomit, they feel somewhat better. And usually unilateral we call it as, but sometimes kids, they will not have this classic pattern of unilateral headache, nausea and vomiting. And they have photophobia and phonophobia, like when they go to direct sunlight, they have photosensitivity, they can't tolerate sunlight. And sounds, they get a lot of irritation with sound. So these are all the features of migraine headache. And causes, if you take, there are two parts in causes. Usually 30 to 35% of migraine patients have genetic predisposition. Like if both of your parents have migraine, you have chances of almost 60% of getting a migraine. If one of the parent has migraine, you have about 30 to 35% of chances that your kids may have migraine headaches. But this is the etiology, and other 60% of the patients, we don't know why they get these headaches. But there are triggers. Etiology means what is the cause is different, triggers are different. So triggers, as I have already told you, there are so many triggers. Some dietary triggers are there. Weather changes also sometimes trigger. If there is summer to rainy season, switch will happen. During those, patients will get headache. If they are not taking food on time, they get headaches. These are all the triggers. If you go, they go to sunlight. If they travel in a bus, if they go to a noisy place like a mall and all, they get headaches on those days. And some foods, ice creams, chilled foods sometimes trigger these headaches. So these are all the triggers for migraine headaches. Sometimes some patients will have irritation to perfumes, and sometimes incense stick smell. So it all depends. Different people have different triggers.
So how do we understand if it is a migraine headache or not?
So that's what I told you, the features of migraine. If you are getting one-sided headache associated with nausea and vomiting, and if you are not able to tolerate light and excessive sounds, and if it is lasting for more than 4 hours, then usually it fits into the category of migraine headache.
Sometimes the headaches are so bad that we feel the head will burst now. So in case of migraine, considering the severity issue, Will this damage the brain?
The number of episodes of migraine does not affect the brain functioning as such. It does not damage the brain. But you will have that pain sensitivity. If you have low threshold of pain sensitivity, then you will get frequent headaches. But that does not damage your brain. Okay. It does not have any long-term consequences. Okay.
And what are the steps to manage migraine?
See, usually most of the patients, they know what are the triggers. Some patients will have some different triggers. So patients, most of them, they know already that these things, if they do, they get headaches. If we want to generalize things, usually hydration is most important thing. At least 3 to 3.5 liters of water per day they need to take. And adequate sleep, 8 hours of sleep is must for migraine patients. Avoid skipping food. You should, breakfast, lunch, dinner should be taken on the same time on daily basis. And avoid tea, coffee, chocolates, cheese and Chinese foods if possible. And avoid perfumes, avoid incense stick smells, all those things to be avoided. Direct sunlight, we advise our patients not to go in direct sunlight. If they have to go, then they have to use UV protective glasses, shades, and avoid using earphones with lot of noise. So these are all the things we usually advise our patients to follow.
Will migraines get better over time without any treatment?
See, one of the causes which has been proposed in migraine is hormone hypothesis. So usually in females, they say estrogen triggers migraine. So most of the females, once they reach menopause, the migraine frequency and intensity will come down by its own. We have seen a lot of patients, those who are getting very frequent headaches, like 3 episodes, 5 episodes in a month, they get better as they menopause. So once after the menopause, usually it drastically comes down. So, but males, there is no such pattern as such. But in females, we have seen most of the patients, post-menopausal females, they get a lot of relief from migraine headaches. In pregnancy, if we see, 1/3 of the patients, there is increase in the tendency of headaches. And 1/3 of the patients, there is no much change in migraine headaches during pregnancy. And 1/3 of the patients, we don't know the reason, it will come down. So these are the natural phases and in a lifespan of females. But in males, usually it does not follow this pattern.
Sir, how do we treat these migraine headaches?
See, actually, there are two patterns of things how we go ahead with management. First, we need to see whether it is purely a migraine or something else. So many times what happens is the patient has been treated as a migraine for long, and once they get severe headache or once they get some limb weakness or once they lose vision, at that time we get an imaging done in the form of MRI and we see some surprises. So first we have to be very much sure that it's migraine or not. So clinical diagnosis is first thing, then comes the treatment. There are two types of modalities of treatment. One is preventive therapy. Some of the patients, every month they get 5 episodes, 6 episodes of headache. They know that next month also they are going to get those headaches. So in those patients, if they are getting more than 4 episodes of migraine headaches per month, we put them on some medications so that they will not get headaches in the next month. And few patients, they get once in 2 months, once in 3 months. In those patients, we usually don't treat them with regular medications. We just give them a pill only when they get headaches. They need to take that medication, they feel better. So if you are getting more than 4 episodes of headache per month, it is always better to consult a neurophysician for regular follow-up and management. And we need to get investigated for migraine patients because they say vitamin D deficiency sometimes triggers migraine headaches. And there are other factors which can add up to migraine headaches. So if you have some of the red flag signs, along with migraine headaches, some red flag signs like fever, having headaches, and the visual disturbances with headache, fits with headache. So in those patients, we usually get an MRI done before we proceed to the treatment. So it all depends on which type and pattern of headache they have. So depending on that, we treat them.
What would you suggest to prevent and reduce the frequencies of migraine headaches?
We have to avoid all the triggers. So what are all the triggers? You need to avoid those. Some of the environmental factors we can't avoid those things like weather changes, environmental things. But those things like caffeine and all, if you can skip caffeine in your diet, if you can avoid drinking tea, and if you can avoid taking chilled foods, if you can avoid alcohol, if you stop smoking, and some of the things like they say yoga, pranayama, and some breathing exercise, patients will become much better. There is a component of stress which increases the migraine headaches as well. And adequate sleep, you need to follow sleep hygiene. So like avoid using mobiles at night, putting off all the lights in the room, and most of the patients they are now into the screen time is very much high. So avoid all that, and keep the lights on the dimmer side at night if you're in the rooms, and cut down on screen time. All those things if you can do, the migraine headaches will come down.
Thank you so much for
Yeah.
sharing your valuable insights. I hope this discussion will help a lot of individuals out there.
Yeah, thank you very much.
Thank you to all the viewers who joined us in today's session on Let's Talk Health. We hope the insights from today's enlightening discussion have provided a lot of helpful strategies to manage and alleviate those pesky headaches. Tune in to Let's Talk Health every Friday at 4 p.m. and empower yourself with valuable knowledge. Till then, stay informed and stay healthy.